Our next panelist is Ann Epstein. She is an internal medicine specialist. She has served as an instructor, assistant professor, and associate professor of internal medicine at the Texas Tech University Health Sciences Center from '85 to '95, then moved into her current position in private practice in Lubbock. Dr. Epstein has been a member of the Lubbock City Board of Health since 2010. She has served as chair of the Educational Policy Committee at Texas Tech University Health Sciences Center and as a member of the Texas Tech University Health Sciences Biomedical Ethics Committee and Institutional Review Board. Dr. Epstein.
Thank you very much for inviting me today. Can everybody hear me? My interest in oil and gas development is from the health risks in my work at the Board of Health for Lubbock. My main focus here is on toxic air emissions, the volatile organic compounds that are emitted along with natural gas and oil development, probably paralleling methane emissions. And for this purpose, I'm focusing on benzene, one of the volatile organic compounds that can form ozone. But this substance is extremely toxic in itself and was a good place to focus. This is a class 1 carcinogen. In other words, its carcinogenic effects are completely indisputable. It causes leukemia. It also causes a variety of non-cancer diseases that suppress the bone marrow, life-threatening anemias, immune system suppression, and possible fetal abnormalities. Very high levels of benzene can produce seizures, coma, and death. And children and developing fetuses are much more vulnerable to the effects of toxic air emissions. Now, the oil and gas infrastructure is plagued by leaks, and some of these leaks include leaks of benzene. This is a study from the Texas Commission of Environmental Quality, which regulates toxic air emissions in the state of Texas. They surveyed in 2009 looking for leaks and for toxic air emissions. They used a variety of infrared cameras and volatile organic compound monitors to survey 94 different sites in 2009. They collected air samples based on what they saw at 73 sites. And what they found was that at 21 different monitoring sites, benzene levels were above levels that were considered safe. And at 2 sites, benzene levels were in the acutely toxic range and required immediate remediation. So what we're finding is, and this is a picture from the infrared FLIR camera of a storage battery set of storage tanks. The black smoke is leaking volatile organic compounds that contain benzene, among other toxins. Now, McKenzie and her colleagues from the University of Colorado measured benzene levels. Actually, they used data from industry, a combination of industry and the Colorado regulatory data. That was volatile organic compound monitors, benzene monitors that were set up between 130 and 300 feet from a series of oil and gas wells in Colorado. And they compared the levels of benzene, ethylbenzene, toluene, and xylenes close to wells compared to a reference point that was 2,600 feet away. And what they found was dramatic rises in these VTECs, that is, these hydrocarbon volatile organic compound molecules, close to wells compared to further away. We don't have much data on benzene levels close to wells versus further away, but this is one of the best studies to date. This was old now, 2012. Showing dramatic increases close to wells. This she did as part of a health impact assessment, and measuring benzene levels and determining whether or not, or projecting health effects. And what they found was that for people who lived close by natural gas development, they projected a 5-time increase. See if I can get this. Health impact assessment, a 5 times, not 5% greater, but a 5 times greater health impact based on living close to oil and gas facilities compared to living far away. This is a health impact assessment projections. This isn't data as a result. This is a projected result. And finally, Gabriela Petron and her colleagues from the National Oceanic and Aerospace Administration and the University of Colorado collaborated to do airborne measurements using this cool plane over here to do a top-down evaluation of benzene and other air emissions, including methane. And you may have heard this study referenced in studies of methane leaks. But she also monitored benzene. And this is an area over the Denver-Julesburg Basin. This is an area of very intense oil and gas development. There are 24,000 active wells in this area. It is an ozone non-attainment area. And previous studies have shown that oil and gas account for 40% of volatile organic compounds in this area. These were 12 aircraft measurements in May of 2012 compared to ground-based wind profilers. And what they found was that benzene emissions were 7 to 9 times higher than that they'd measured. Measured benzene emissions were 7 to 9 times higher than was estimated by the state of Colorado inventory. So you might know that when people apply for oil and gas permits, they are required to estimate their emissions. And the producers are required to estimate emissions. And those estimations are based on industry records and standards about how much is expected to leak and be emitted during ordinary operations. And so this state of Colorado inventory expects a certain number of benzene emissions, but as you can see, the actual measured amount was considerably greater than the state's estimation. So based on these elevated levels of toxic air emissions, I looked at studies that have currently been done regarding health effects. And there are very few, but let me show you the 4 major ones that are quite significant. This is the biggest study so far. This was done again by Lisa McKenzie and her colleagues, the same people who did the health impact assessment in Colorado. They looked at a cohort of birth records, all the birth records in Colorado compared to all hospital records of birth defects. Remember, I had said that benzene and toxic air emissions have a greater effect on developing fetuses and children. So a good place to look for toxic effects would be in pregnancy and developing babies. They had, their data set included 124,000 birth records. And they compared these to a map of gas wells and plotted how close, for each record, how close the mother lived to a gas well at the time of childbirth. And they divided into 3 groups, low, high, and medium exposure. Notice the high exposure group is over 124 wells per mile. And the reference group was no gas wells within 10 miles. And here is what they found, the number of babies born with congenital heart disease. This is major heart disease requiring surgery and perhaps a lifetime of medical follow-up for these babies. There was a linear increase compared to 0 wells within 10 miles. For people in the low exposure group, 1 to 3 wells per mile, 10% increase of congenital heart disease. For medium exposure group, 20% increased risk. And for the high exposure group, 30% increased risk. These were all, you can see that tremendous p-value, all highly significant and adjusted for multiple risk factors that might have influenced benzene, or might have influenced volatile organic compound exposure. This is the biggest study to date. And since then, this is June 2015, there was a similarly designed study coming again from Pennsylvania. This is an area of very intense natural gas development in the Marcellus Shale. 15,000 birth records, 509 active wells, estimated exposure. What they found was that babies that were in the highest quintile of natural gas exposure, greater than 6 wells per mile, had a 34% greater chance of having low birth weight compared to the lowest quartile. Once again, statistically significant. And another study in Pennsylvania, 10,000 babies compared to, once again, location compared to well location. In the highest quartile, those babies had a 40% increased risk of premature birth compared to babies in the lowest quartile. It wasn't just babies. We have finally data on adults. This came out, this was all coming out last summer. This was a record, a review of hospital records, 95,000 hospital records in Pennsylvania. Again, sorted by zip code for wells. So which wells had the most wells, and which zip codes had the most wells, and which zip codes had the highest concentration of wells. And what they found was that adults who lived in zip codes with the highest concentration of wells had a greater number of hospitalizations for heart disease. And in the highest quintile, there was 44.7 hospitalizations for heart disease compared to the expected, which was 35, a very significant increase. There was also an increase in adult hospitalizations for neurologic disease. This is for people who are living close to gas wells. So in summary, the health risks for oil and gas wells have just recently been published, and we're seeing significant increases in health risks and in diseases in babies and adults for people who live very close to gas wells. Remember, oil and gas development has really just been started since 2008, and so there's been rather few studies until finally this group of studies have come out in the last 2 years. So we on the Board of Health had recommended to the Lubbock City Council that we increase setbacks, that we require that wells be built further away from people than they are now. The state of Texas requires that wells be built now only 250 feet away from residences. And as you can see from McKenzie's data that I showed you, toxic air emissions are very high, very close by. We expect that procedures that will reduce methane emissions will also reduce emissions of these dangerous volatile organic compounds and hopefully reduce some of the disease. But wherever there are gas wells, there are toxins in the air. There seems to be a significant leak problem, and we suspect that the ordinary process of natural gas development also produces a substantial amount of risk. Thank you.